Frye. I'm the host of KOPN's Your Health Matters, your weekly health information program. And for you people who've been waiting for our August program on osteopathic medicine, your wait is finished. We have finally, in spite of scheduling errors and double bookings and illness in the family, we got this program finally on the schedule for tonight. So tonight, our guest host is Elizabeth Allemann.
Good evening, Jeff.
Our regular guest host.
Thank you so much for having me and letting me open up the microphones and the airwaves, to issues that matter to me a lot. And this evening we'll be talking about osteopathic medicine, and my guests in the studio are Maria Coffman and Erica Waddington, both osteopathic physicians.
Hello, thanks for having me.
And although osteopathic medicine was born in Missouri, just north of us in Kirksville, many people are not very familiar with osteopathic medicine and what it is and what it can treat and why everyone should have some. But we'll be talking about that this hour, and at the end of the hour, we'll be well informed.
Those people who are numerically challenged.
Thank you.
There we go.
What is osteopathic medicine?
Sure. That can be a our question in itself, but we'll use a briefer answer. And osteopathic medicine in the U.S. is one of the two fully licensed fields of medicine, with allopathic being the other. That's an M.D. degree, and osteopathic medicine, which is done by a D.O. with an osteopathic degree. The larger differences between those two fields, even though we train together in a lot of our programs, is that the osteopathic physicians put in an additional time in their training in their first 2 years of training in medical school, and also during their second 2 years when they're out in the clinicals and doing hospital clinicals and office work. They learn hands-on treatment and assessments to apply to the body, and they're often called manipulation. So osteopathic manipulation is one distinct difference for an osteopath from an allopath. Otherwise, our education is so similar that we osteopaths can take the allopathic boards.
And we have the same license.
And we have full licensure in all fields. So in America, an osteopathic physician might specialize in cardiology, surgery, pediatrics, and they might specialize in the hands-on treatment, which is osteopathic manipulative medicine. And that's what I do.
And so tell me a little bit about that. I mean, it's a little bit like talking about wine, that we're going to talk about it even though it's more of a body experience. But if you could try to describe what is osteopathic manipulation.
Yes, I'm sure this answer would have changed for me every 3 to 5 years over the past 20 that I've been working in this field. And at this point, what that means for me is using a hands-on approach, but also the whole person approach to coordinate, evaluate, and help someone to look at their own health in all different layers, whether it's just their physical health or their emotional health, spiritual health, and all those things that are layered in within our body, and helping them to balance that and synchronize it to a healthier state. In my practice, what that looks like, it looks very gentle. I do use my hands for either perhaps adjusting a joint or articulation, or maybe adjusting and helping to bring the body to balance in its own soft tissues like membranes and ligaments, organs and their coverings called fascia. And there's a whole field of osteopathic manipulative medicine called osteopathy in the cranial field. And in the non-osteopathic arena, that's called Cranio-sacral. Right. And I think that term is a little more commonly known. And that's working with obviously the cranium, the head, the skull, but also the membranes and the dura covering the brain, and how this affects the entire body all the way down to our toes, and how we move and how we're set up to coordinate our bodies, and even affects things such as the emotional state of someone who might be a little high-strung or someone who's a little more sedate than their optimal time could be.
So the actual treatment is the touching of the skin, laying on of your hands, but it's gentle pressure designed to help the body find more energetic and physical alignment. Am I summarizing that in
balance? I think that's really good.
Okay.
I think you made a good point. Some people are concerned if they've never heard of osteopathy, or they're not sure what to experience when they're going in for a treatment that includes manipulation. It's typically done fully clothed. It's on a padded table, something like a massage table, depending on what type of manipulation the operator or physician uses. Might be a thicker padded table or not. Mine's thick. And it's pretty comfortable. And it's very important that the patient is very comfortable throughout the procedure, and it is considered a procedure.
So this is not, I mean, sometimes people refer to folks who do manipulation as bone crunchers, but there's no crunching or cracking involved.
Oh, there absolutely can be. In my particular practice, I don't use that technique a lot. There's a technique called high velocity, low amplitude, which I can employ, but I don't find a lot of use for it personally, and that's just my personal preference of me as an operator working with a patient. And
we have a phone call.
Oh, excellent.
So
hi, you're on the line.
Put these on. Okay.
Hi, this is Victoria, and I'm interested. I missed the name of your guest, and I was interested in who is speaking. The name of who is speaking.
This is Dr. Maria Coffman.
Maria Coffman, K-A-U?
It's C-O-F-F-M-A-N.
And you're in Columbia?
I'm in Columbia.
This would be a great time, Maria, to give your contact information. It sounds like at least one person would like to know how to find you.
Okay. And the phone number, the office is Hands On Health, Osteopathic Medicine, and the number is 573-256-1331. Would you like a website? I suppose I'll give that. The website is www.handsonhealth.do.com. I almost gave the wrong one.
And I'm going to ask you a much more practical question, because I was a patient of Carol Brown's for years.
Yes.
I'm a big advocate of the manipulative DOs. Yes. Are you an insured DO, or do you only take private pay?
We are private pay, so it's considered out of network for your insurance company. Mm-hmm.
Thank you very much.
You're welcome.
Bye-bye.
Maria, your office is in Doctors Park, right up on West Broadway. Is that right?
It is, across from the library. It's
the 200 block of West Broadway, across from the library.
Mm-hmm.
So, and the caller is gone. Is that right? Thank you so much for calling. Those things help. It's nice to get to know that somebody's listening.
And if if you didn't get the names, there's probably a half dozen other people who wish they had the names as well. So that's how, listeners, you make a big difference by calling in your questions. Today is October 27th, I believe. Is it 26th?
It's the 26th.
The 26th. If you're listening on another day, it's recorded, and your telephone calls, though still appreciated, will not be on air. So make your calls today, October 26th.
Right. So, Maria, we were talking about what people experience during an osteopathic manipulation treatment, and it's pain-free. Is that correct?
I'm thinking about your acupuncture now when you say that. No, it doesn't have to be completely pain-free, but it is more optimal when I'm treating. I prefer that the patient be very comfortable, and I like the results I get when I can help the patient stay in a comfort zone. Occasionally, there's something that's may be needed that may be uncomfortable. But for the most part, it's very comfortable and gets more comfortable during the treatment.
And how about afterwards? How do people feel after the treatment?
Now, that can vary quite a bit, and I always put that in my my handout instructions after a treatment. And as DOs, we all know that patients can have some reactions that are with soreness. And although we strive to keep working on different ways of treating and working to keep the body energetically balanced and musculoskeletally balanced, so there's less of that reaction. There can be some soreness 24 to 48 hours afterwards. Most of the time, people feel really relaxed when they leave. Sometimes my secretary has to call them back to help them remember to make an appointment or finish up details at the front desk. And they know they're going to be really relaxed. I have one set of office workers that comes in, and I think their joke was Gumbified. They said, "Oh, well, we always make our appointments for the last thing in the day because we can't go back to work and stay focused." But I think that's not everybody feels that way. They could feel some good focus, but there's a nice decrease in any tension, and there's a very relaxed state of a very healing state that occurs afterwards.
And in my experience, a lot of people feel that way after many kinds of body work. So after a massage or after an acupuncture treatment, people may feel relaxed and sometimes a little giddy, because there is some evidence that acupuncture actually releases endorphins, which are the natural pain controllers in our brain, and I'm going to guess that osteopathic medicine does the same thing in some people.
I suspect it does. I don't know about the studies on that one.
Okay. So now, do all osteopathic physicians are all osteopathic physicians trained in doing osteopathic manipulative medicine? Yes, and my usual take on that is finishing medical school, whether it's D or M.D., but in this case, osteopathic medical school, doesn't make one a cardiologist, it doesn't make one a surgeon, and it doesn't make an osteopathic specialist. But all of those areas are available for further training and study. And at these days we do board certifications, so that's what we do, and I'm board certified in manipulation. So your training after medical school was actually in manipulative medicine, is that right? My specific training, I did what was called a pre-doctoral fellowship. So I stayed in school an extra year and did teaching and research in osteopathic medicine. And I did a family practice residency. Okay. It was an osteopathic residency, so I did attend osteopathic clinic, and we did do continued training throughout that. And then for my board certification in manipulation, I did an additional 250 hours of conference CME, and then writing up cases to sit for my boards for osteopathic manipulation as well. So I was boarded in both. So it's similar to an allopathic or an osteopathic physician who chooses another specialty, say cardiology or dermatology. You've chosen as a special area of interest. Correct. And extra training and board certification to do manipulative medicine. So what kinds of things do people bring to you? Most commonly people think of osteopathic medicine, if they're familiar with it, they're thinking of musculoskeletal discomfort, back pain or headaches. Back pain, headache, neck pain, rib out. If they've seen a DO before, I've got a rib out. Maybe hips and other joints and knees and ankles and feet and that sort of thing. So they're thinking bones and joints. Mm-hmm. And it is definitely, that's actually the second name of our boarding is neuromusculoskeletal medicine. And so that's a lot of the practice. I see all ages, so I actually see and treat newborns and babies, toddlers, young children, adolescents, and all the way through to the elderly. And using those techniques, we don't have to be so concerned if we're not doing a jarring type of technique. We don't have to be as concerned with osteoporosis or other delicate states. But so I see plenty of the musculoskeletal complaints. Other things people come in for that they are starting to catch on to is asthma, gastroesophageal reflux disease, or GERD. And do you treat even infants with the gastroesophageal reflux? Yes. And I treat it as an augmentation to whatever treatment they may be getting. And what happens is most of them are able to get off of their medications if they've been on medication for reflux. And with those little fellas and little girls, they often have a cranial strain pattern, either from
their time in the uterus or with their birth process. And it's often putting a little pressure on either the vagus nerve, which innervates the guts, basically, their digestion, or they can also have a diaphragm dysfunction where the muscle of the diaphragm has some tension on it, and it's pulling on that opening that allows the esophagus to go down to the stomach.
And the diaphragm, for people who maybe don't have their anatomy books in front of them, is a muscular structure that separates the lungs from the abdominal cavity where the guts are. So it's what keeps, and it is used when we contract our diaphragms, we can open our lungs and breathe in. And you can know when your diaphragm is doing something funny when you hiccup.
That's right. It does do that. So we see those. I think another field you talked about was the cranial dental aspect. So I do see a lot of folks for dental.
Explain that, because I think that's an important area, and it isn't exactly logical or intuitive that if a person has challenges with their teeth that they should see an osteopathic physician.
I think the first thing that started coming to the office were the dentist referring for temporomandibular joint dysfunction, TMJ, dysfunction and pain. Okay. And I used to say, well, they're working hand in hand. We could work on both sides of that because I worked on the temporal bone aspect while they were working on the mandibular aspect. And of course, in osteopathy, we can address both sides of it. It's kind of nice. And as we got more and more of that going on and seeing that the temporal bone has the joint space for the jaw, the mandible, to sit up in it, we started working a lot more with how the cranial bones are arranged and how they have a little bit of give to them, and we know that they have motion to them. So that developed quite a bit more, and quite a few DOs across the U.S. now are working in the osteopathy in the cranial field as it applies to dentistry and orthodontics. So I go to Dr. Spencer's office down in Sedalia about once a month and see patients with him right in the orthodontic chairs, and we've just had some really amazing experiences that both of us kind of walk out and go, wow, I didn't know that could happen.
So these are people whose teeth are crooked.
Right.
And they need to have their teeth straightened for one reason or another. Either they want to because of the appearance, or they're having some difficulties with chewing or pain in that joint there in front of your ear, or their teeth aren't matching up the way they need to.
Correct. The occlusion over there.
And you, with your gentle treatments, are doing something that affects that.
Yes, it is affecting it. So one of my favorite stories was after a few patients we'd seen together, and Dr. Spencer moved from one chair to the next, and I was going to check the cranial pattern and make sure that the head had what we call flexion and extension. It's a very subtle motion, but we wanted to make sure that patient's head was moving symmetrically and well after he had adjusted one of the wires or changed a wire for a patient. And she had come in, for lack of a better term, with the two front teeth kind of bucked. This is a woman probably in her 40s. And at age 11, she describes that she had had an injury to the front teeth where she'd struck her mouth and her upper jaw on a ditch and shoved her teeth out somewhat. And they've been kind of bucked ever since. So this was several months into her treatments when I first met her, and one of the front teeth was coming back nicely and in line with the light wire that he uses, and the other one really wasn't. So he stepped up and he pointed to the one tooth. He said, "That one's just not behaving like I expect it to. It's not working with the model that I have." And this is all models. Everything we're doing is models. But so I looked over and I thought, well, I'll just check the tooth itself and see if it has a ligament that's tight or out of balance, and see if we can gently balance the ligament. There's actually a technique called that, balanced ligamentous tension technique. So I went to check the tooth, and
so you actually put your fingers on the tooth.
Yeah, I hold the tooth, and I check to see if it has a preference in motion. Believe it or not, and it did. So I held it and did what was that particular technique, and checked also with the bone that holds the tooth in, the maxilla, sitting under our top lip. And I felt it go into a nice balance point like I would feel any other joint or tissue do if I were using that type of technique. And then I looked at it again, and I thought, whoa, that's in line. It's
like it was in line. Within a minute or so.
30 seconds. So I looked at the tech who was getting ready to tie in the new wire, and her eyes got big, and my eyes got a little big too. And we called Dr. Spencer over and said, would you like to check this one? And with his great demeanor, he says, well, that'll do it. And went off to the next patient. We're like, okay, we might have something here. So that really helped. He's able to work so far. And then when our models, it's the same with any type of healing or treatment. When our model takes us so far, but then our expectations of how that model applies to a problem doesn't work any longer, then we need to look at a new model.
And you can try something new.
And we have some new models to try here. So.
Okay. And do we have you're waving your finger at me, Dr. Frye.
Yeah, we need to do some of our bottom of the hour.
Okay, well, I wanted to do one thing first. I wanted to say that Dr. Waddington is also in the studio, and she's been nodding her head vigorously throughout all of Dr. Coffman's descriptions. Did you have anything that you wanted to add?
Well, and so I'm a family medicine resident, so I'm finished with my osteopathic
at MU.
In Kirksville.
Oh, at Kirksville.
Yeah, at Northeast Regional Medical Center in Kirksville, Missouri. And
are you doing musculoskeletal medicine up there?
Yeah, so my residency is an integrated residency with family medicine and OMM. So it's a 4-year residency. I'll be boarded in both when I'm done. And I'm in my 3rd year of that training. And when I first came to osteopathic medicine, I was amazed at how much health you can facilitate in someone's body with your hands, and that's what I kind of fell in love with. And the farther along I go in my training and the rotations that I do, what I've learned is everybody has the potential for health in their body, and sometimes you just need somebody to help facilitate that. And I think that's what body workers, DOs who do manipulation, that's what we're doing. That's what it feels like we're doing. So, yeah.
Mm-hmm. Yeah, thank you for that nice affirmation. We're all sort of in agreement here in the studio.
We all sort of are.
And we are now
even those high velocity, low amplitude people.
Those are great too. Those are great.
and we are also in agreement that it is at the bottom of the hour, and we have some station identification to do.
Station identification, some technical housework involved with keeping this radio show on the air. Speaking of which, we just had Pledge Drive last week. We raised over $25,000. I want to thank any listeners who donated to that pledge drive. If you still wish to make a donation, and
KOPN will always receive your money, and it will always be very well spent.
It will be well spent. You can do it online securely at KOPN.org, and it'll direct you at that website to how you can donate securely using PayPal or credit card, I guess, online. We're going to go into a little bit of bottom of the hour housekeeping and other things, and we'll be back with Dr. Coffman, Dr. Waddington, and Dr. Allemann in a minute.
And welcome back. This is KOPN 89.5 in Columbia, Missouri, and this is Elizabeth Allemann. I am guest host with Jeff Frye of Your Health Matters, and my guest tonight is Maria Coffman, who's an osteopathic physician, and accompanying her is Erica Waddington, who's an osteopathic physician and still in her training.
Thank
you. Maria, I'd like for you to give your contact information again for people who've heard you on the air and have decided that they've just have to have some of this osteopathic medicine treatment.
Again, that is the website is handsonhealthdo.com, and I was formerly Dr. Maria Katsaros with a K, and that is still up on the website. The phone number for the Office of Hands on Health is 573-256-1331. Thanks.
And as we were about to take a break for the end of the hour, you were talking about some work that you were doing with a orthodontist. And if people wanted to find the orthodontist, can you put his contact information up on your website so they could find him, or you can give his name and his
location? That will be coming
again.
up. And his is Spencer Orthodontics. He is Dr. Gerald Spencer in Sedalia.
Okay, and so he's in the phone book, and
He is, and he's easy to find on the website.
And so he
on
is
the
working
web.
with you to help people realign their teeth and the bones of their head together in the same thing. Am I speaking of that respectfully enough?
You are, but I wanted to smile because when he first called me about a year ago, that's exactly what his idea was, and he'd taken some of the cranial orthodontic classes and needed someone who could actually do those things. And it doesn't stop at the head. So what we find now, even in his assessments, he takes a full body photo, and we'll see how the pelvis is following the jaw in direction, and how the body reflects that pattern all the way down to our toes.
Okay, I'm having a little paradigm shift here.
Okay.
So when someone has crooked teeth, they may have a crooked skull, and I can understand that because your teeth are in your skull, so of course that would make sense. But then what you're saying is the skull is connected to the rest of the body.
You got it.
And so the rest of the body may be crooked as well.
It may be, and it may actually be the cause of why the skull is crooked. There may be...
but if you start to fix one of them in a gentle, respectful way, the rest of them may come into line.
Quite often.
Okay, so you're now describing orthodontic crooked teeth, the repair of crooked teeth, as a whole body holistic therapy.
Yes. And it is wonderful to keep integrating because, medicine in America, we tend to section out the teeth and the feet, I guess, podiatry and dentistry and ophthalmology. We section these out into subsets, and they're not. And for that matter, even optics and ophthalmology, optometry, glasses and vision affects the way our head moves as well, and can be the whole cause of why we need glasses to begin with if our faces are asymmetric and the orbits are sitting asymmetrically. We start looking around, most people have quite a bit of asymmetry in our faces. And I usually think about the German model. I'm sure there are many other models too, but German model of medicine, and visiting with a colleague who said that they have to pass the dentistry boards to graduate.
From medical school. So they don't separate out their teeth separately from the rest of the body, but here we really do. I feel like we kind of get a little bit of an idea how to handle it in the ER maybe, and some of my background was ER, so it's like, when do I need to call a dentist or an oral or a maxillofacial surgeon? But it's really just about to save a tooth from dying, not
to.
Or we might want to know how to treat a dental abscess if it's affecting the health of the person.
Right.
But yes, I'm not sure that we studied much about teeth in medical school at all. A little bit in anatomy and embryology.
No.
How about you? Did you?
No, none of that.
And did you,
No,
Dr.
I
Waddington?
didn't
Did you not even? And you went to an osteopathic medical
and
school.
I just recently graduated in 2009. Barely.
I think it was like maybe 2 lectures for me.
Yeah.
You didn't
all the way
barely
through.
graduate.
Well,
Compared to us.
You just recently graduated.
Oh, right.
Barely graduated means you just barely got through. Do you know what the last person in your class is called? The last person, the lowest ranked person in your class is called?
Doctor.
Doctor, right?
Recent, not barely. That's good.
Right. Right. So even among osteopathy, in osteopathic medicine and osteopathic medical schools, the teeth are still sort of
medical
not
school is kind of set out there,
integrated into the.
So the bite and of course the health of the teeth, like you talked about, very very important to our whole body health. An abscess in the mouth is no different than an abscess anywhere else that we'd need to attend.
And so, if a child is growing up and is having some teeth that look a little crooked, are there osteopathic approaches to that? And
certainly are.
That's a little bit of a leading question, right?
Yes. The first thing I think of is, again, is addressing the person where they are. And Dr. A.T. Still is who founded osteopathy and started the first school in 1892, and he has a lot of quotes.
Just to show that MDs are not, he was an MD.
And he was an MD. Thank you so much, Dr. Frye. He was an MD, and he has a great book of quotes. But one of his quotes is, "Treat what you find," and it's one of those truths that just keeps coming up, allopathic or osteopathic.
Absolutely.
So the patient comes in, okay, I have 3 children with buck teeth, but that's just one little finding. It's like saying fever. Oh, you have 3 children with a fever, and we're going to treat them all the same. Only if we want to cool off the fever, and put them all in a cold pack. But if we want to find out what's causing the fever, then we want to treat that. And that's what we find when we have a child or an adult come in with dental orthodontic type, either crooked teeth or their teeth aren't lining up well, or they're not biting well. And oftentimes the first thing we have to look at is airway. And do they have a really good, can they breathe well? Can they breathe through their nose? Can they keep their mouth closed? Literally. Or when they're at rest, reading a book or watching a show or something, does the child or the adult have their mouth open? And if that's the case, the first thing I need to look at is it's open for a reason. They probably can't breathe through their nose. And it produces a particular posture. If we start looking around at folks a little bit more, we'll see that head the whole head will sit forward, kind of a head thrust forward.
I'm aware that my head is thrusting forward.
Well, we all are with these microphones.
Right now.
I know. I think it's a microphone. And we're all just sitting here. We're all doctors. We'll probably all remember, in CPR, the way to open the airway on an unconscious person is to take the jaw and pick it up off the face, basically, to create openness in the airway, or to do intubation for anesthesia. There's a particular area of lifting that opens up the airway from the nose and up in the pharynx down through the trachea. And we can have issues of swelling, allergies, or just drainage issues, not getting enough lymphatic drainage out of the face and those deeper tissues inside of the pharynx that produce enough swelling that someone really can't breathe easily through their nose, so they have to breathe through their mouth. If the mouth's open...
That's a significant difference between allopathic and osteopathic training. Is how much talk did you do about the lymphatic system?
I had actual classmates who said they were punting lymph. They knew they could get through medical school if they never learned anything about the lymphatics.
I did not, until the last 10 years, I did not believe that there really was a lymphatic system.
Oh, I'll have to say that I think I was...
things I could say on boards, but I really didn't believe that they were really there.
No, I'll have to say that I tended to pay attention to that. I might have been rebelling against my classmates, but... yeah, I have, but I know that it does matter, but I didn't know I didn't know anything to do with it. Mm-hmm. Right. It's also amazing. Like there's no point learning about a system if you don't have anything in your toolbox to fix it.
Right.
But it sounds like you do.
We do. Yeah. And coming right out of school, we've got things to do to help fix.
So people with allergies and chronic nasal congestion and chronic nasal drainage can go to an osteopathic physician and
who does manipulation
right.
and find potentially helpful
things. And things they can do at home too. Some of those techniques, like we joked before the show, that it takes a while to learn all of these things, but there are quite a few things that I can hand a patient to walk out the door and that they can safely employ for themselves and work on that. So lymphatic drainage is one of the easiest to pick up and do for a person.
So a child who has, or a child or an adult who's having some dental occlusion issues, the first thing you would do would be to help with lymphatic drainage.
If that were their problem.
If that was their problem, right. Then are there also some other things that you would do? Say their mouth is... Why does it matter if their mouth is closed?
Yeah. So if they're not breathing, airway is usually first. That's first thing to address. If that's not the problem, then we'll go to the next part 2. But if they're not breathing through the nose and the mouth is open, then the lips are open, and the lips have the tone and the muscular tone to hold the teeth in line. It shapes how the teeth lay there.
So they balance the tongue.
So the next piece you're asking me is the next thing I look at. If their mouth is closed and they actually have their lips closed during exam and while we're visiting, then I have to look and see what's the tongue doing. Is it doing what's called a tongue thrust, which is an infantile swallowing response that's supposed to shift at about a year and a half when they start to get teeth, and we're supposed to move our tongue in a different way when we swallow. But many people retain what's called a tongue thrust. Speech therapists know this one really well. The people talk like this, and they get
Castilian Spanish, right?
You got it, Castilian.
Barcelona.
There you go. And if that's the case, then with every swallow, when we swallow something like, I don't know, multiple times a minute, I don't know, 30 times a minute or something. And with each one of those, the tongue is coming forward and pushing the teeth forward. It's stronger than an orthodontic wire. So we would have to overpower that, and then we take the orthodontic wires off and we'd stick our tongue out and there pushes them back out. So it's really important that, number one, the mouth can close. We have an airway, the mouth can close, that the tongue doesn't have a tongue thrust response. And there are two ways of looking at that for treatment. One is cranially. Is there pressure at the base of the skull from a tissue strain that's squeezing on the cranial nerves that go straight to the tongue? There are two that go straight to the tongue, hypoglossal and glossopharyngeal. And some difficult births, or even pretty much any birth in intrauterine time, can produce a strain pattern on the cranium. So that can be all the way back to when we're formed. And the other aspect of helping that, once I know that the nerves to the tongue are working, but the habit is still there, or we need to retrain that area, then there's a whole field called oral myofunctional therapy. And that is therapists that either come from, they're either dental hygienist or they're speech pathologist. And those are two fields that cross over in this area called oral myofunctional therapy. And they're basically, I think of them as PT for the mouth and tongue. And they can help retrain where the tongue sits in the mouth and how it swallows, and really have a lot better function with the orthodontics later.
So thank you for that description of how orthodontic care really is a holistic whole person care. And while we were talking about that, Dr. Waddington, it sounded like you had something to say about lymphatic drainage in ears.
Yeah, there's techniques that you can use on kiddos who get otitis media.
Ear infections?
Ear infections that you can teach moms. It's very easy to do. It's gentle. And dads, of course, because with kids, there's a little tube called your eustachian tube that connects your inner ear down to the back of your throat, called your pharynx. And with children, it's more horizontal, so fluid tends to stay there. And as we grow up into teenager and adulthood, it becomes a little more vertical, so it's easier for them to drain the fluid that's in there. And that's why people who tend to get ear infections are kids, little kids. And so there's very gentle techniques that you can do, kind of a massage that you can do kind of on the side, below the ear, kind of at the neck, that osteopathic physicians can teach you to do for your kiddos if they have recurrent ear infections.
And that can be done either to prevent another ear infection or to treat one once it happens. Is that right? And that's a part of this lymphatic drainage system, because the lymphatic system is an important part of our immune system. It's sort of the vacuum cleaner and the filter for our tissues.
Oh, yeah, absolutely.
And so it sounds like you're saying that abnormal lymphatic drainage can set you up for an ear infection, and also an ear infection can make the lymphatic drainage more difficult.
Because of congestion and edema.
And so helping with that is going to help.
Yeah.
Is that treat what you find?
Yes, it is treat what you find. And that is a great technique that Dr. Waddington is talking about. And I send that home a lot of times with parents, and they're really grateful to have something they can do in the middle of the night to hold the child and do this in addition to an analgesic or something for pain. And it's very helpful.
One of the things that interests me is that colic, which happens at a certain time, probably has a osteopathic treatment as well.
It does, yeah.
But we used to put the baby on an infant seat and sit on top of the clothes dryer, which is warm and vibrating. But
its peak is around 3 months, and what's happening then too is the fontanelle starts to firm up a little bit. So whatever cranial strain pattern we were born with and made it through with for a few weeks, with that ultra pliable soft head that we have to begin with, starts to firm up a little bit, and that strain pattern stays in there. Then we have the brain still trying to grow at rapid rate, and all of its membranes moving against the strain pattern. Pretty much, this is one model of colic, and it works. It works for me because we don't have any other good models for colic, but to work at a diagnosis. But when that starts to grow like that, everything moves and grows in a direction of ease, including our heads. but it's not always symmetric or even, and sometimes it really is uncomfortable. It's also going to put some pressure and pulling on another cranial nerve called the vagus nerve that's going to the gut. And that can really put the child in a bind. And when I did practice emergency medicine, I had a few of those nights where the 3 to 6 month old coming in, they've had a nice big pediatric workup for their crying and discomfort and sleeplessness. So we had nice coverage that there was no big metabolic problem with the child. And I just get to go sit with them for a few minutes and treat their body and head, treat what we find, and send home a quiet baby with a couple of young parents, and it just made everybody happy.
Is there a technique you teach the parents what to do besides put them on top of the clothes dryer and run it?
Yeah. Sometimes I'll teach them a gentle massage for the head or the abdomen, kind of depending on what the primary problem is for that child. And sometimes of the low back sacrum is an area.
Okay, now one of the things that I have noticed that is helpful, and the thing is, colic is defined as crying. So a baby that cries more than 3 hours a day, that's the definition of colic. And I'll have to say that in the circles I travel in with a lot of breastfeeding moms, many of them have found that their babies decrease their crying when the mother changes her diet.
Sure.
And so I'm wondering how you see those things coming together, or if you do.
Well, it's like you said, treat what you find, and we certainly have to address all those other factors. I suppose for me, colic then is defined afterwards, after we've already said that they haven't had a diet change.
Right.
The child has not had a big diet change, or and another isn't ill with an infection. That's
right. Well, I was just talking to a woman recently whose baby had colic, and then was told that the baby had reflux, and the baby's demeanor changed abruptly when the mother cut cow's milk dairy out of her diet. And I was encouraging her to still consider either acupuncture or osteopathic medical treatments, in part because she said, well, if it's better, why does it matter? And I said, well, why is your baby not tolerating you eating dairy products? Is it that it's two things coming together, that the baby has a misalignment or the baby has an energetic imbalance, and that's why this amount of difficulty is causing the baby to be so unhappy?
Right.
Does it also have a headache?
Building the reserve. You're right.
Like, it can tolerate a little bit of a low-grade headache and be a fairly happy baby, but then you give it a bellyache, a little bit of a bellyache, and it's miserable.
Yeah. I think that's a great point. A lot of times I'll talk about that aspect of the patient of building the reserve. I think what Dr. Erica had said of how much health we could access in a patient, and taking a person, and looking at their state of health and where we can go, oh, here's an easy spot to get some more health, some more reserve. And for that child, perhaps with the dairy sensitivity, that's one of the areas. Is like, oh, here's an easy place to take care of getting some reserve and health for you. We'll stop the dairy for now, but let's find out where else you can get reserve so you can tolerate a little dairy sometimes.
Right.
That would be helpful.
And then also you sometimes treat people with head injuries, is that right?
Yes. Post-concussive head injury, again, be like a grade 1, which is no bleed
right
on a CT scan, but we just really don't have a great protocol for post-concussive headache and just kind of that out of it feeling that people will have after a concussion, whether they had a whole loss of consciousness or a very brief loss of consciousness in a normal scan. Even from an ER perspective and family medicine perspective, we just would say, okay, we just need to watch you up to these 2 weeks, and then
hope
you're
you
good
get
to
better.
go.
Right.
But they don't feel good, and
so the osteopathic treatment sometimes helps with people feeling better.
Definitely, and of course with the training and the skill in osteopathic cranial field, that's where we're trained to really feel those fluctuations or changes in the fluid going through the body, and particularly through the head. And many times it's in an asymmetric feeling, just like watching someone walk asymmetrically. The head can feel just like that.
It's just very interesting. Doctors have a tendency, I'm guilty, probably Elizabeth is not. When you can't find anything wrong, you say, there isn't anything wrong. Well,
right.
The point is, there is something wrong, but there's nothing wrong that they can find.
Right.
Right. And I'll have to say this is one of my problems with our profession, Jeff.
Yes.
And that is that when our skill is limited in being able to either detect or to help somebody with a problem, we blame the patient and we say there's nothing wrong with you and we don't know why you're here. Mm-hmm. Instead of claiming that there's something wrong with our profession. Like this is an inadequacy of our profession. It's not perfect. So yes, you have a problem. Clearly you have a problem and I can't help you with it. Instead of I am perfect and you don't have a problem.
Mm-hmm. And since I can't fix it, there's obviously nothing wrong with you. That's
right.
the logic, right?
Right. All I have is a hammer and you're not a nail, so go away.
Those are hard.
Well, what we would encourage patients to do when they come up against this is to try a different direction.
Right. And I think that, one of the signs of insanity, I think it's Alcoholics Anonymous that claims this, is doing the same thing expecting a different result. So if you keep
Einstein said that, but
okay,
go with both.
Whatever.
He probably got it there.
Right. Maybe he did. Anyway, when people have a problem and they keep going to the same kind of healthcare provider for the problem and getting not any help, then I would recommend they go to a different one. And so I usually recommend that people look carefully at the letters after their provider's name. So if the letters are the same, even though it might be a different specialty, you still haven't really consulted a different healing tradition.
Good point.
Yeah.
And so you have to, they might have no letters after their name, but they need to be practicing a different healing tradition, and there are many. I think the National Institutes of Health recognizes 85 healing traditions.
Different healing traditions besides allopathic medicine.
Right. So, yeah.
It's models. Yeah, I still will say that, the models I think of when I'm either treating on a muscular level or a fascial level or a cranial or dietary or nutrition or family, it's all models that we're looking at, and Chinese medicine and such. And I think you're absolutely right. When we run out of models, we need to look at our healthcare system, and it's bigger than just D.O. and M.D. So you need to look outside that and apply some more models.
Well, we're reaching the end of the hour.
Yeah.
Thanks so much for coming. I do want to make sure we did not have time in an hour to talk about all the things that
we never
osteopathic
got past
medicine.
The neck. We just worked our way down.
We did.
We got to the jaw. We've got a lot of show to go yet.
Should we do it again?
Okay, 3 minutes, quick. No,
tell them about rib and the Kirksville crunch, but we'll do that next time.
There is that.
Yes. So we'll have to do more. We'll probably need a whole hour for the chest and one for the abdomen. Yes, so we'll need to do it again. But thank you so much.
And then we have to put it all together because that's what this is all about.
Yeah.
They're all
There's
connected.
That, right.
So we talked about everything because we started.
I know. Well,
yes.
You've got to do it some way. Got to start someplace.
In a holographic way, we have covered all of health.
Holographically,
Yes.
Because we started.
Now, speaking of programs that we left unfinished.
Yes.
In August.
Chris Link was here.
Holistic physician,
yes.
an MD.
Yes.
Who said, when I
challenged
told him,
us to a diet.
Well, actually, no. I challenged him first. I said, but Chris, there's nothing you can do about
C-reactive protein.
Changes the C-reactive protein and the sizes of your HDL cholesterol.
Right.
And Chris said, "Oh yes, there is."
And again, we were 3 minutes left in the hour.
3 minutes left in the hour. Next month, Elizabeth and I
we've changed what we eat.
Took the challenge. We changed what we eat. We've been following Chris's diet. So about 4 weeks from now,
we had our blood drawn.
We had the Wednesday before Thanksgiving, I believe it is.
Yes,
maybe
I
the
think
one
so.
before that, but
it's like the 17th or something.
Yes, the 17th. Chris is going to come back again and go over our results.
We're going to get our lab. We've eaten differently. We got our lab drawn. We're eating differently. We're getting our labs drawn again, and we're going to talk about it on the air. And Chris has done the same thing, so he's got his before and afters as well.
Oh, he did. Well, he couldn't lose any more weight.
No. I think he has lost some, but I mean, his before was a long time ago.
Oh, I see.
Yes.
So we've just done this in 8 weeks.
Exactly, and we're awesome.
Fantastic.
Well, it has been. So far, we'll say it's been
life changing.
It has been remarkable, and I'll endorse life changing.
But you have to tune in when we're here again and hear all about that. So
November 16th, I believe, is the date of that program. And
super, we'll be listening.
Yeah.
So make sure you turn in. I don't have a challenge left for you, Maria. So we have to plan on if you want to find out what the osteopath can do about from the
Right.
chin down,
We'll have to,
you'll have
come
to
back.
tune in at a later date. But very interested to talk about some more stuff about lymphatic drainage and some of the lower velocity osteopathic manipulation techniques.
Thank you so much for having us.
It's been great.
Been a pleasure.
Thank you.
I hope you all learned a bit about osteopathic manipulation and osteopathic therapy. Thank you both, Dr. Coffman and Dr. Waddington. Welcome to Your Health Matters, and hope you can make it back down again. And I hope our listeners learned a bit about this and new ways they may go for their health, because their health matters.